The name of this course is Psychological First Aid, a community-supported model. This course was created under a partnership of the University of Minnesota Preparedness and Emergency Response Learning Center and the Minnesota Department of Health Office of Emergency Preparedness. This course is an overview for MRC volunteers, hospital personnel, disaster responders, and first responders to the concepts and applications of psychological first aid as it applies to assisting survivors and fellow responders impacted by a disaster or emergency event, particularly in the field during a response. This training may also be useful to other individuals when dealing with a personal crisis situation in their family, community, or workplace. It will take approximately 45 minutes to complete this online training. Upon successful completion of this course, you will have the opportunity to create your own personal resiliency plan. After passing a post-test, you will be able to print a certificate of completion, granting you .75 continuing education contact hours. To begin the module, click on the Start button. After completing this course, the learner will be able to demonstrate knowledge of the principles and techniques of PFA as they apply to a disaster response. Identify at least 7 common physical, emotional, behavioral, cognitive, spiritual, and sensory reactions to a traumatic event in adults and children. Demonstrate knowledge of the concept footprint of disaster as a model for the impact of a disaster on people physically and emotionally over time. When provided with scenarios and profiles, select and provide appropriate PFA responses to individuals presenting with common reactions, positive coping strategies, maladaptive coping strategies, and severe reactions to traumatic events. Demonstrate knowledge of responder stressors and principles of self-care as they apply to a personal crisis or a disaster deployment before, during, and after an event. And apply knowledge and understanding of principles of self-care to the development of a printable personal resiliency plan. Let's begin by answering the questions, what is psychological first aid, and why is it important in a crisis or emergency situation? An excellent definition is offered by the Australian Red Cross in their 2013 pamphlet on PFA. Psychological first aid is an evidence-based approach and intervention built on the concept of human resilience to help survivors in the immediate aftermath of a traumatic event, crisis, or natural disaster. PFA can help everyone: children, adolescents, adults, elders, and families. Designed to reduce the initial distress caused by these events, PFA acknowledges the seriousness of the experience of danger and the increased feelings of vulnerability that often follow. PFA fosters long and short-term adaptability, basic functioning, and coping skills. Psychological first aid is a humane, supportive response to a fellow human being who is suffering and who may need support. Psychological first aid is an approach to helping people affected by an emergency, disaster, or traumatic event. It includes basic principles of support to promote natural recovery. This involves helping people to feel safe, connected to others, calm and hopeful, access physical, emotional, and social support, and feel able to help themselves. The principles and techniques of psychological first aid meet 4 basic standards for best practices. They are consistent with research evidence on risk and resilience following trauma. They are applicable and practical in field settings. They are appropriate to developmental levels across the lifespan, and they are culturally informed. The community-supported model of psychological first aid integrates public health, community health, and individual psychology. It includes preparedness for communities, workplaces, healthcare systems, schools, faith communities, and families. It does not rely on direct services by mental health professionals. And it uses skills you probably already have. Before we can understand psychological first aid, we need to understand that when people encounter a disaster or crisis situation, they experience stress. What is stress? The International Federation of the Red Cross defines stress as a very broad term, referring to the effect of anything in life to which people must adjust. For instance, Anything we consider challenging causes stress, even if it is something we willingly choose to do. The key is that stress requires us to adjust our attention and behavior and makes demands upon our energy. In a disaster or emergency, there is a psychosocial stress response that begins with the shock and impact of the event. Normally, most people will initially feel fear and distress. For some people, they may respond with behavioral changes that interfere with their ability to maintain or regain stability. A few people will experience psychiatric illness as a result of the impact of such an event and will need psychological intervention. The first question we may ask when we hear about a disaster or crisis is, was anyone hurt or killed? This is an important question, but it needs to be understood that the medical impact or footprint of a disaster is smaller than the psychological footprint. Many more people will experience a psychological stress response than will sustain physical injuries, and the psychological impact will affect a larger geographical area than will the medical impact.